Morning, Alliance of Delray. This is Lori Vinacore, Executive Vice President. We have a great meeting today. We have our Chief Nursing Officer from Delray Medical Center that's going to be speaking about COVID-19 and all the processes that are happening there. That's John Secreto. And our other guest is Ann Gannon, tax collector, and we'll be hearing about office procedures with her tax collector office as well. We start out, of course, with just a few announcements, and then we'll hear from our first responders. The first and foremost is the McDonald's issue. Of course, we all know that it did pass with the Board of County Commissioners, except not 100%, which is nice, but still it passed, and we're getting a McDonald's at Legends Way and Atlantic Avenue, much to our dismay, and we are not happy about it. We had 5 commissioners present at the meeting. 2 were not present. And our District 5 Commissioner, Mary Lou Berger, was not present at the meeting. She had a personal issue, and she will be back next month maybe, and she may even be speaking to us next month online. But there were 2 not present. There were 5 present, and 1 commissioner, Mayor Kerner, voted against the McDonald's application and the 24 hours, and there were 4 that voted for it. And as far as the 24 hours goes, Mayor Kerner and Commissioner Greg Weiss both voted against the 24 hours, but it did pass with 3 commissioners. So the 24 hours is going to happen, except they are not going to be having any deliveries between 11 p.m. and 6 a.m. so we don't hear backing up and the beep beep. That's all. President Bob Schulbaum will be addressing this issue too.
I will speak a little bit about McDonald's. Vice President Lori spent a lot of time with it. She was up at in West Palm and trying to convince them there to reject it, and they didn't, which is terrible. When that building goes up, that place is going to be very difficult to get off. But there's nothing we can do about it. Lori's very close with it. We have to thank her for the work that she put into this. She tried everything that was possible to get them to reject it, but it didn't work out. And the fact that two of the commissioners left made it even more difficult. So I'm going to turn the meeting back to Lori, Vice President, to give you further reports. I'm glad to be able to talk to you, and thank you all for joining us. And as long as we need to use the Zooming, I'm sure that Lori will be running a meeting. All right, Lori, it's all yours.
Hi, yes, 67 seat restaurant. That's what's going to be there. We're going to do as much as we can to help the situation as they're building, to keep it consolidated in that area so it doesn't interfere so much with the traffic within Villages of Oriole Plaza. It's really, really tough. The other thing is about the face masks. All of our delegates and presidents will be receiving one Alliance face mask in the mail. We care about you all, and we thank you all for all the emails you sent and correspondence regarding the McDonald's issue too. So thank you so much about that, for that. We have wonderful, wonderful community leaders here in the Alliance of Delray, and we're a great big family. One thing about meetings at the Civic Center, I did connect with them this morning, and we might be going back. It might be maybe 2 months, maybe a month and a half, 2 months. We might go back. But if we do, we'll probably have to have it'll be limited, and we'll probably have to have people RSVPing in order to get a seat in there. So we'll continue to give you information about that. But for now, the Zoomcast meetings are terrific. Everybody can see at this time, 10 o'clock in the morning on this first Wednesday of every month. And also it will go onto YouTube. So we have many more people after watching this. We had, for the McDonald's issue, we had over 3,000 views when it came to the application. So Right now, we have some people raising their hands, and my co-host is going to be handling that and just letting me know what's happening with that. So if you have a question, you want to say something. I see Jim Rosenthal. Hello, Jim from Lexington Club. We love you all. If you can write a Q&A, question and answer, I'm sure you have it right there. We'll get your question or whatever it is, and we can answer it for you or address it or send you an email about it. Okay, so that's how we communicate with the Zoomcast and you can also, everybody will be able to ask our panelists questions too, but you just need to ask the Q&A because we have a lot of people here on the screen. These are the panelists. So our attendees will definitely be heard with your name and your question if you can write it down. Thank you so much. And we have Captain Sant, who is going to be highlighted now. Okay.
Ready to go?
Spotlighting Captain Sant now, and Sheriff Bradshaw would have loved to have been with us. He's got a very important issue today that he's dealing with. So we don't have him today here. I'm sure he'll be here again next month. We have Captain Sant to please give us a report. Thank you so much for coming.
All right, you got it. Good morning, everyone. I hope everybody's doing well and staying healthy. I'm going to give you guys a quick update as far as the crime goes in West Delray Beach. Good news is that we're steadily seeing a decrease in the crime within the district. Steady crime decrease as well in all categories. I do want to tell you guys this, the scams that are being reported throughout the district, once again, are a top priority. There's a couple other scams I want to discuss with you this morning. Be very mindful as you guys are shopping, your family members, and shopping in the Costco's or Home Depot's, or especially the dollar store. I hate to pick on any one particular business, but I want to raise your awareness to two particular places that we're having some problems in. One is Costco, and the second one is the dollar store. We're getting a lot of distraction theft. And if you don't know, if you have never heard of what a distraction theft is you'll be shopping, come by, either bump into you, establish communications with you that make no sense. And in the meantime, you'll have a partner taking your wallet or your purse right out of your car. So please, I urge you to pay attention, make sure you have your personal property on your person, and limit your conversations. I hate to say this, but limit your conversations with strangers, just building some type of rapport with you while you're shopping. Also, the scams for our debit cards are still on the increase. All right. If anybody should call you and represent themselves as a bank representatives, do not surrender your card. Do not give them the numbers. They will not call you for you to surrender your bank debit card. All you need to do is hang up on them. There's a number on the back of your card I'd like for you to call your banking institution and report that. At that point, you don't need to call law enforcement. Just make sure you call that number on the back of your bank, your debit card, and report that to the bank, okay? If you forget anything I said just now, just remember this: hang up on them. Do not discuss anything or give them any information, okay? I want to tell you something I think that really set in here. Year to date, we had 141 total scams reported. That's just reported. 141 total scams throughout West Delray Beach. That's District 4 under my command. Of the 141, we have a reported total. This is just a reported total estimate of $493,000 of loss suffered to the victims just in West Delray Beach. Again, I say that's just reported, and that's an estimate. I firmly believe there could be even more money that's lost, more monetary loss. But right now we have $493,000 worth of loss. All right, so please take this opportunity, speak to your friends, speak to your family. All right, discuss this with anybody that'll listen to you. We have to do better in this area, because they'll continue. These predators will continue to prey upon this area and those like it, specifically retirement communities. if they know they're going to continue to get away with it. Last but not least, I want you guys to know also with the scams that are occurring, we have made some significant arrests. So these criminals are not working with a full impunity here. We've made some significant arrests, but I also want you to know that it is extremely taxing, time taxing for the detectives working on the subpoenas, drafting the search warrants, arrest warrants, which takes them away from a lot of other pressing matters we have going on here. Okay, so please help us help you. Other than that, I wish everybody well, and that's all I have for you this month. Thank you.
Thank you, Captain Sant. We will have a meeting summary of this. Carol Klausner, one of our directors on the board, makes the meeting summary up and it gets sent out the next day or so. So all these things that you're telling us will reiterate in that. Thank you so much. And of course, we can always go back to the YouTube video and you can watch that.
Thank you.
So we're going to spotlight Chief Tozy now. Thank you so much for coming. Please give us your report.
Good morning, everybody. I apologize again. I'm having more technology issues. Ironically, we're going to be talking about technology here in a second. So I'm coming to you via my cell phone. Notice I'm in my office, though. I'm not driving. One of the things I wanted to mention is for a number of automobile distracted drivers. Ironically, it's not our teenagers or our 20-something base drivers that it's occurring with. It's actually our senior population or our senior demographic. So kudos to everybody that's getting so up to date with their technology. That's wonderful to see. I think we're going to be seeing a lot more of it. So as a reminder, please, no texting. And I know you've heard this before. You've probably given that advice to some of your loved ones, but we need to adhere to our own advice. No texting. You really shouldn't be eating, especially McDonald's hamburgers or French fries. All right, sorry, that was a bad joke. But we shouldn't be eating in the cockpit either. So one thing we do at Fire Rescue for a number of reasons, and I'm sure the Sheriff's Office does it as well, is we like to implement what they call a sterile cockpit. And this was actually brought to us from the airlines when they attributed a number of air disasters due to activity happening in the cockpit of the airplane at inopportune times that resulted in a deleterious effect for the flight and the flight crew. So what you want to try and do when you can is have a sterile cockpit, which means you shouldn't be jabber-jawing with your neighbor, the one in the passenger seat. Keep it to a minimal amount of conversation. You really need to be paying attention because these events are happening at a split second. And often, it's affecting people's lives dramatically. It's taking lives and it's causing some really serious accidents. So please, no texting, as we know. Try and have that sterile cockpit. It's very important. So just to go through here on Hagen Ranch, last month they ran 380 calls. At Station 45, they ran 558. And at Station 52 on Pheasant Walk, 133. So the numbers are down a little bit from last month, which I hope is the medical alerts or the COVID type activity. I hope we're seeing that kind of ramp down, and we are. But one thing I wanted to discuss with you is out of those numbers, let's just look at Kings Point, for example. Out of the 558 calls they ran, 495 were medical related. And I promise you, out of the 495 medical related calls, about 400 of them were falls. Falls where people have gotten up and it's usually in the middle of the night. We've had to come out and either help them back to bed, which we want to do, but we hate going there and seeing that they're injured and we have to take them to the hospital or care for them. We don't like to see the needless suffering. So where I'm going with this, one of the things we're identifying, and it's something to speak to your physicians about, we've got two amazing medications that are being prescribed to our senior population. And one of them is a diuretic, which I'm sure a lot of you have heard of, and it's a very important medication that you need to take. But another one's called Ambien, and that's a tranquilizer or a sleep aid. So let's think about that. A sleep aid and a diuretic. They probably aren't the best two medications. They're necessary, but when you put them together, what's happening? You're having to get up in the middle of the night to use the restroom, and what's happening? You're under the effects of this sleep aid or this tranquilizer, and I really believe that's causing a lot of the falls. So what is the solution? Well, number one, always take your medication as prescribed. That's important. Don't stop, okay? Just to repeat that, don't stop taking these medications. But what I would like you to do is talk to your doctor about getting either a bedside commode or a urinal. That way there, it's going to minimize the amount of steps you have to get up in the middle of the night to use. So just a thought, something to help keep us all safe. And that's my big goal, is to see that you guys are safe. Other than that, that's all we really have. I hope everybody's continuing to wear their masks. As mentioned, be safe. There is an end in sight. I don't know when it is, but let's not let our guard down. We've done an amazing job. You really have done a great job in our community, staying safe and keeping all of us safe. We hope that that continues. And then on one further note, I'm thinking about 2 more weeks or so, we're going to be reevaluating our community, our classroom space. I don't think it's going to open then, but hopefully we'll sit down and look at moving forward when we can reopen that for our different groups that like to come and meet here. I would estimate somewhere in the 2-month time frame, but we'll get back to you in a couple of weeks. We'll look forward to seeing you again shortly.
Thank you so much. Thank you, Chief Tosi. I have a message here from Senator Berman, who says hello to everybody. She wishes we could all be together. In the future, I will actually be able to have some elected officials come on. We'll work with them to, if they'd like to say a few words to everybody like we used to in the Civic Center following our first responders updates. So we'll work on that. Okay, so we're going to spotlight John Secreto. He is the Chief Nursing Officer at Delray Medical Center. And we are going to have an update from John Secreto, Chief Nursing Officer, and we're going to spotlight him. And here you are. Now, we'd like to hear all about our neighborhood hospital and what's happening and how you're protecting us, and of course, how you're protecting the staff and all.
Good morning. Thank you, Lori. Before I begin, I want to say thank you to the Delray Alliance and the community for sending your prayers, your cards, posters, food, the parade drive-bys, which we really enjoyed from local HOAs as well as our first responders. Just an overwhelming outpouring of support from our partners in the community and local government leaders for what we do here at Delray and for our community. So again, it's very much appreciated. I also want to thank you for the opportunity to provide this update to the Delray Alliance. Talk about a few topics: safety, communication, operations, support of our community, and recognition of staff, and some concerns that we have here as professional caregivers for our community. First of all, how we're keeping up with the community, patients and physicians, staff safety. The basics is what we're doing in the community as well is universal masking of everyone. So everyone in the building is universal masking, hand washing, etc. We're wearing our PPE per CDC guidelines. As we know, this is a unprecedented time and things are still very fluid. We have monitoring of our employees, active monitoring of staff within the COVID units. And unfortunately, to further keep everyone safe in the building, we've had to limit our visitors since March of this year to a very few. Also, we've limited our vendors and anyone else in the hospital that doesn't have day-to-day business here. Those that absolutely do have to come in, that we've put together a monitoring protocol, answering those standard questions of travel symptoms, as well as taking temperatures and ensuring that they're masked while they're here in the building. In addition, I'd like to share a little bit about operations and what we're doing in the hospital itself to keep our patients safe on the COVID units, as well as on the units that do not have COVID patients. So the first thing I want to discuss is infection isolation versus COVID isolation. So routinely, what we would do in healthcare for a patient who's in any type of isolation other than COVID isolation is those folks would stay in one room on a unit, and that room itself would be an isolation unit with that caregiver or any physician entering the room, donning and doffing, which means putting on and taking off that PPE, and then throwing that away. What's different about COVID is because of the sensitivity of the infection itself and the highly rate of contagion, we've created COVID units. So what that looks like is an entire unit has been segregated from the general population, actually 6 to 7 units. And there's an anteroom that we have created a double wall, double doors that the caregivers will go in and they'll put on their PPE, and they'll spend the entire shift on that unit with the PPE for that shift. So instead of taking the PPE off and putting it back on in between patients, which it highly increases the risk of that caregiver being exposed to the virus, we assure that we keep that risk as minimal as possible by having the caregiver keep that PPE on, unless they're going out to break or something like that. So we have 6 to 7 units that are designed that way with a total of 150 beds that are segregated from the rest of the hospital population. Our facility has 536 beds, so we are well poised to conduct business as usual and keep the patients segregated. The 150 beds are segregated away from the other beds within the hospital. So that being said, I will share a little bit, not getting into numbers, but I will share that from the beginning of the pandemic until now, our COVID population census is at 25% of what it was, which is very good news. As far as communication, we provide newsletters, our CEO, our COO, myself, marketing, we provide newsletters, emails to our staff, to our physicians. We have routine meetings. But more importantly than that is the face-to-face daily rounding that we have within the hospital to have real-time discussions, alleviate fears, and answer questions and show support for our caregivers. I can't stress enough how important it is to have the open lines of communication in and outside the facility. I've touched a little bit about operations. What I also want to share about those specific units is we've created for the unit design, once we have shut them down and created COVID units, we've put in a reverse airflow. So what happens is that air is pulled from the hallway into the unit to further reduce any chance of that virus being transmitted out into the hallway or throughout the facility. Again, another way to keep the hospital community safe. What we're seeing and what you guys are seeing as well is right now fatigue in the community. So we've been out just as you have as well. Shopping, wherever we see people that are not wearing their masks, they're tired of staying home, they're tired of quarantining, they're having parties, they're opening up their doors and having visitors. And we need to stress that really that's not the way to contain this virus. We've done a great job so far in the community, and I think we need to continue, and we need to support each other on this. Yes, it's true that we're all tired, and this has been a very long 7 months, but we're not going to beat this virus by giving up or letting our guard down. So just like the chief just mentioned, stay on your guard. Absolutely continue to stay on your guard as it relates to combating this virus. We are concerned that we might see an uptick in the COVID virus now that the schools have reopened, now that the holidays coming up. Again, there's that mask fatigue, that quarantining fatigue, very concerning to us. The beaches are open. So please help us in being our voice in the community and explain to the staff that it's best to follow the guidelines put out by the CDC, continue that diligent masking, the hand washing, the social distancing, everything to keep yourself and your family safe. A little bit about community outreach. So we have partnered with the City of Delray to provide community in-home COVID testing, and that has gone over very well. As well as for the past 5 months, I personally, as well as some of my team I've taken with me, my director of nursing professional practice, my infection preventionist, etc. We've visited the skilled nursing facilities in the local community, independent living, assisted living, and assisted them with not only COVID testing of their residents, but also education of their staff, education of their residents, prevention of infection and exposure. And we share best practices, how to create a safer environment to assure the safety of their staff and their residents in their facilities. Another point I want to touch on is our recognition of our staff. Our staff have been working very hard these past 7 months in this unprecedented time, providing the highest quality care to our community. We've developed a Behind the Mask video series, which features stories of inspiration and teamwork across the Palm Beach Health Network from our caregivers. And finally, I'd like to leave you with something that we find very concerning. So, you know, as the elective procedures were put on hold, and now we've recontinued them, what we saw in the community in general, our surgical volume and procedures is down here at the facility. So what has happened and what this means is that the people who need necessary, and I want to stress necessary. So elective is a very loose word. Really, these are necessary procedures that the community needs and our patients need. So the necessary medical surgical care that they need, they're not seeking it. They've been staying home. And even though we've reopened these procedures, our volume is down, which means people are continuing to stay home. And I'm guessing it's out of fear. So here's the outcome. So their conditions are not getting better as they stay home. They actually get worse and they deteriorate. And this contributes to people suffering at home. And many of these folks in our community are in pain. We've seen some very poor outcomes in the community for patients who should have come to the hospital and did not, or waited too late. So my advice is, and the advice of our facility and our caregivers and our physicians, please do not wait. It is absolutely safe here at Delray Medical Center. Please seek the care that you need. We are here for you. It's a safe environment. We are well poised to have continue our operations and keep the COVID census and the COVID patient population segregated from the general population. So please, I implore you, if you need medical care, please come seek it at Delray Medical Center. This concludes my update. Please be safe out there and continue your diligence in reducing the numbers of COVID exposures out in the community. And I'm open for questions if you have any, and I want to thank you again for this opportunity.
Thank you so much for your presentation, and thanks to Delray Medical Center for keeping so connected with our community. It really is wonderful, and people must remember to call 911 if you have an emergency. It's
Absolutely.
safe. Yes, the first responders are all prepared. Our Delray Beach firefighters and paramedics are prepared. Our Palm Beach County firefighters and paramedics are prepared to protect anyone who is injured, and they can bring them safely to the hospital, where, of course, the hospital will take really good care of us. Well, that's a terrific update. Thank you very much. We all know to keep our social distancing, and that's just what we're doing on the Zoomcast meeting, but we're still staying connected. And we now are going to connect with our tax collector, Ann Gannon. Yes, and she has presented with us many times over the years. I'm going to spotlight Ann Gannon now. Okay, my co-host has spotlighted her. Great, and it's great to see you here today. We have a presentation which Paul Finkelstein will be running here for you. He's starting the screen share for Ann's. She's a woman who needs no introduction. She is our constitutional tax collector serving Palm Beach County. So Ann, go ahead.
Well, thank you. And I'd like to say that our lives really have changed. And the former speaker talked about how they've changed and what we've done. But I did something because I'm single and at home by myself. I adopted a kitten. She's coming to live with me in about 2 weeks. I won't have to talk to myself now. I can actually talk to her. But so I wanted to share that, and her little face is on Facebook, and she's so cute. Her name is Biden, but she is cute, and I think there are many people who are doing that just out of the fact that they're living by themselves during this terrible crisis that we've been given. I do want to also say that we were the first agency in Palm Beach County that required masks of our employees and all of our clients coming into our offices. And we will continue to do that no matter what other agencies or the county do, because we deal with more clients than any public agency in Palm Beach County. And so we have a commitment to keeping the public safe, but keeping our own employees safe. And I will say that during the initial shutdown in our office, or the initial time we came back, we had an employee in our call center who actually got the virus and gave it to about 4 other employees. So during that time period, there was limited ability for us to answer calls, but we've done some changes to our business. Our business model, by the way, has totally changed. And I personally think it's changed for the good. But if you want to turn to the first page, and we'll kind of talk about on March the 17th, we actually limited the number of clients served in person in our offices. All of our front counters were closed to the public. And on March 24th, we reopened to serve clients online by phone, mail, and email only. And because of this pandemic, we are enlarging our call center, and in the next month it should be enlarged, and we should have additional people serving the public, because about 25% of our business is now transferred to the internet, and many of the clients who call us just need a little help understanding what they need to do. And that was always one of our goals. The pandemic gave us the opportunity to actually change our business model. Most of our offices May the 1st reopen to the public, some by appointment only. March the 20th, I missed my March the 20th because I read only above the lines, but we did close our offices for a week to the public. On April the 27th, we reopened our Delray Beach office for driver's license only, and we did that for one reason, which was to actually, now that we're doing appointments, to see how that worked, and worked out some of the kinks in the services, which helped us a lot. And on June the 1st, we actually opened all of our offices to appointments only, and there were a limited amount of appointments that we have now opened we were also testing a new appointment system at that time, and had been for the last year. So when it really went live was during the pandemic. And on June the 1st, we opened all of our office to appointments, a small number of appointments. And since that time, we have enlarged the appointment system so that we're back to dealing with 3,600 clients throughout our system in 1 week. So it actually has worked very well. The public likes it. We tell them to come in 10 minutes prior to their appointment. They will be guided to the line, and you get in and out as quickly as possible. There is no seating in any of our offices at this time, and probably never will be seating. Well, there is seating in our central service center because the seats are attached to the floor, but we never let in more people than we physically think that we can deal with within 10 minutes to safeguard our employees and to safeguard the public. So you must schedule all appointments on our website. We do not accept walk-ins any longer. Our services that do require a reoccurring trip to our office would be new residents requiring a Florida driver's license and transfer out-of-state title, road tests and written tests, and complex title work. Most of the business that we do can be done on the internet. And if you have a driver's license that you've renewed twice on the internet, the third time you do have to come in our office. That is because we want a new picture of you. As you age, the government wants to make sure they can figure out who we are and get an up-to-date photo of you in the record, in the whole system. As many of you know, the Real ID has actually been put off until October of next year. But Palm Beach County was one of those counties who made our office, a strong commitment to getting most of our citizens Real ID'd. We have about 80,000 people who have not been Real ID'd, whether they're people that just need ID cards or they no longer drive. But to travel, you need that card. So They have now another year to be able to do that, the Real ID compliant driver's license, which you would have a gold star in the upper right-hand corner of your driver's license. And anyone can make an appointment and bring the appropriate documents in, and we can accommodate them through appointment process. Do you want to change pages? One of the next page. Sorry, I should have told you. We have implemented additional safety measures in our offices. All clients and employees must wear a mask or a covering. Protective barriers are installed at all of our front counter workspaces. There's no waiting seats in lobbies. We do additional cleaning and sanitizing, and social distancing takes place. And a month ago, we implemented temperature taking and measuring the oxygen in a person's system, so that we could, if a person has a fever over, I think it's 100, it might be 104, they are sent home to their doctor and they are put on what's called emergency leave. And they stay there until they are then required to go get tested, and then they are asked to retest to be able to come back into our office to ensure that they are COVID-free and cannot give COVID to any of our employees. We've also done an air purification systems installed in all of our offices. And you know, since we've installed those systems in our offices, we have had very, very limited COVID cases in our office, but we do have a whole process in place. If there is a COVID case, you are required to go home. We clean the space next to you. We also have the county's team, their green team, I call it. They come in and spray our offices to kill the germs. And that is done every time there is an identification of a COVID case or a potential COVID case, so that we can actually protect our employees and the public. Although many of our facilities are back office work. So we have that. And our branch offices actually have an advantage in that they're typically 5 to 6 feet away from each other. Our administrative offices are a little more challenging, but we've tried to adapt to that and figure out a way to keep our employees either at least 5 feet away from each other in their workstations. So, and it's been challenging because this building that we're in is 30 years old. It was never built to even think of a pandemic coming. But we've begun to think in new buildings of what we need to do to protect our public and our employees. And as all of you know, we are building a new office out in Westlake. It should be open in a year, and we will be closing our Royal Palm Beach office. This office out in Westlake will look a little bit like our Central Service Center, much brighter and bigger, but there again, we will not have chairs. Appointments will be required. And when we talk about appointments, let me share with you that if your driver's license cannot be, and if I got a notice that my driver's license needed to be renewed, the first thing I would do is go on the internet. When I get the license, don't wait until your birthday, because your license expires midnight of your birthday, not midnight of the month you're in, which is what most people think. You will not be allowed, you will not even have or find an appointment that's available if you wait till the latest. So we send those notices out 90 days ahead of time. And I, like many people, I just put the paper down and walk away, and 2 weeks later pick it up. But my suggestion to all of you is to deal with it immediately, because we've had a lot of people come in our office that waited till past their birthday, and they are driving illegally, and there are fines and additional fines and fees that you must pay. And so dealing with that now, when you get the notice, is my recommendation to you to make that appointment. our appointment system. You can go all over our system, and there are 6 offices you can use. Some do driving tests, some don't do driving tests. And those typically are like downtown in West Palm Beach. There is nowhere else. There's no place for us to do a driving test. We have changed our driving tests so that you must have another person in the car with you. We have a phone we give you and a different test. And our employees are not in a car with you, just to safeguard their health and your health. So it's a little bit different process and procedure, but we partnered it for the state and tested it, and it works well, and they're using it also. And as many of you know, we do not accept citizens of Florida that do not reside in Palm Beach County. And let me explain to you why we do that. Because we're paid $6.25 to process a transaction or a driver's license, which is nowhere near the cost of those licenses providing that service. It actually, our property tax payments subsidize all the state work that we do. And we've made a decision here that we're not going to do that, because I don't believe our taxpayers should pay for residents that live in Miami-Dade or Broward County, because they have limited services available right now. And it's been challenging for them. But for us, I think we're doing the right thing to be able to serve our employees and to spend our tax dollars wisely on what Palm Beach County residents want. You want to change the next slide? And during this time of COVID, we spent time updating our website and changing it based on surveys and comments that we did with the public. And the other issue, which everyone is dealing with, is our websites have to be ADA compliant, or we can get a very difficult high fine from the federal government for doing that. We updated the content. We used friendly navigation, mobile responsive design, and then, as I said, our ADA compliant for universal access, and an online scheduling system, and updated contact us forms. As you know, we also have on our website a client advocate that if you have questions about the services that you need and don't understand how to access them, if you email us through the client advocate, you will get an answer within 45 hours or less. We are retraining our call center employees so that they have updated knowledge of how to deal with our public without having to get back to the client or without having to send the question to another person in our service center. We would like to hear from you if you have comments about that, or if you have complaints about it, because that's what we're here for. So if you would change the page again, I would appreciate it. So these are all the things you can actually do on our website. You can pay your taxes, real estate and tangible personal property. And tangible taxes are what businesses pay that are furniture and fixtures in a business. Delinquent tangible personal property tax, tourist development tax. We actually implemented a new system for tourist development tax along with the new ordinance the county passed, and local business tax receipt. We've had a lot of business in local business tax receipt. As many of you know, the county had funding from the federal government called CARES funding, and many of our small businesses had never registered their business with the state or the county and had the appropriate licenses. So we worked very closely with the county to ensure that that happened, because many of them were small businesses, 1 and 2, or mom and pop businesses that needed to continue to operate to run our economy, because it was so critically important. They're getting ready to open that up again. So if you know any small business that could apply for the CARES funding, you need to tell them to go on the county's website and talk about, pull their forms down and go through and update. And then our motor vehicle and driver's license service, you can renew your registration or your driver's license within that 90 days. And by the way, if it becomes delinquent and you haven't paid within that 90 days, you have to come in our office. Or you've renewed it twice over the internet, you would have to come in our office. So we have really tried to listen to our public and update our services. And if you want to change the page. What we found out during the pandemic is that our office is an essential business, meaning that we cannot we cannot close our business. We have to be here to provide services, and we had to figure out how to do that. An essential business, because we collect taxes, and without those taxes, your county government and your city governments cannot operate without those payments. So it was challenging for us to figure out how to protect our employees, protect our clients, and be able to do the business that we're required to do under Florida statutes. So as I said, we were the only business operating during March and April the only government business operating during March and April during the pandemic, the beginning of it. So it was challenging, and some of our employees were challenged by it, and I understand why, because it was challenging for them. But we're committed to serving you safely. Keep in mind that we're now having our offices, because our schools have not opened. Many employees who are on what we call emergency family leave now, if the schools don't open for 12 weeks, they're on 12 weeks of leave. And some of them are taking 2 weeks or 3 weeks, but what that really means is that we have a reduction in employees, and it means a limited ability to serve our public. So that's going to be challenging for us also, to figure out how to serve the public in the most expedient manner. So we're actually asking you to have a little patience. We will get this done. And if we need to go back to I will tell you, if you can't get in our office to get a driver's license, because you've either waited too long or we sent the notice out, you can go to the state and they will give you a temporary license for 180 days. I personally do not have the authority to do that, but they could do that for you if you go to the Department of Motor Vehicles, their website in Tallahassee. They can do that for you, and they're very good at facilitating that. So our new appointment system is very easy to operate. It's not hard, and if you have challenges or questions about it, please call us. Don't get frustrated like a lot of people do. Our whole world is moving more and more to virtual and to different kinds of virtual services, and some of us are, I could say I always understand how the program works or where we're going, but I don't understand where the program is and where we're going all the time either. So I don't want the public to feel frustrated about that either. So if there's any questions I can answer, I would love to do that.
Thank you so much, Tax Collector Gannon. Really, you have risen to the challenge that this pandemic has brought on. I'm sure that they can get in touch with you if people have any questions. I don't have any Q&A right here now. You've done an excellent job of explaining everything that you need to about your office during this pandemic. So thank you very much for coming today. Well, we're coming to the end of our meeting now.
Thanks, Lori, and all of you for just being there and facilitating the communication into communities that we don't have access to at this time.
Thank you. Thank you. Well, we're coming to the end of our meeting now, and just to mention next month's program, it's going to be an exciting program because we have to focus on other things as well, because things are still going on, and some really tough issues such as sober homes.
Yes.
sober home and human trafficking. So next month, we are going to have guest speakers to find out where we've been with legislation in the past and where legislation is going with the sober home and human trafficking issue that we have here. And we'll be having State Attorney Dave Arenberg, and we will have Chief Assistant State Attorney Alan Johnson. And we will also have former Senator Maria Sachs speaking on where we've been, where we're going with the sober home issue. And State Attorney Arenberg's been doing a fantastic job with the sober home task force and all. And this will be a very interesting subject and things that we all need to know, because these sober homes and treatment facilities, they're right in our midst. So we need to know how to handle them and how to protect the public, how to protect the people who are in the homes, and how to protect neighborhoods. So we'll have that next month. And right now, we don't have, our panelists are here. Nobody is asking to speak again. And we have had no Q&A from, of course, oh, Mike and Katie Adler, thank you. They say a shout out to them from to our panelists. And it's great to see you all, even if it's just virtual. And hopefully we'll be back soon, and everybody will be wearing their mask from the Alliance of Delray when we go back to the Civic Center. So long all, and have a great month, and you know how to get in touch with the Alliance if you need anything at all.
Thanks, Lori.
Thank you all.